we love hosting this event. It's great having the EDC and chamber staff and having this collection of community leaders. It's probably the only time of the year I see this kind of diversity of leaders in the room. So this is awesome. It's a real opportunity for us. And it's also my privilege to talk about the amazing work that our staff are doing. And so, of course, you can't talk about healthcare without at least acknowledging some of what's happening at the federal and state level, at a policy level. So I'm going to attempt to do that politically agnostic perspective. So if you can bear with me. So again, why this is important to Mason General Hospital and family of clinics, what's happening at the federal and state level, is because 2/3 of our reimbursement come from Medicare and Medicaid dollars. So it's critically important and certainly has our attention, the policy debates that are happening right now. Another reason why it's important is 6,000 people currently in Mason County are insured because of the Affordable Care Act. And so 6,000 over 60,000 approximately total residents. So 10% of Mason County residents have coverage as a result of the ACA. And then to give some further numbers behind this, if the ACA was to fully be repealed, we've run the numbers and we estimate that that would have approximately a $2.5 million negative impact on Mason General Hospital and family of clinics, obviously a material number. And further perspective on that, last year, 2016, we had net income of $2.4 million. So a full repeal would put us slightly in the red. So that's at the federal level. Compounding the pressure is then what's happening at the state level. So before the Affordable Care Act, state and federal, so the state and federal governments split Medicaid dollars roughly 50-50. With the ACA, that moved up to federal covering roughly 90% of the Medicaid dollars. I'm trying to keep this simple. So on top of that, with the expansion of Medicaid, roughly 600,000 Washingtonians now have coverage. So a very material number of people. The state is very committed to increasing and maintaining that access. So just doing the numbers against, I think the state is still trying to reconcile a budget. And so you can juxtapose that against the McCleary mandate that they're still trying to reconcile for public education funding. So trying to then additionally fund that, if you're bearing with me on the math, that 40%, going back from 50 to 90%, so that if the state had to shoulder that additional 40% of those 600,000, it's not happening. And so that also has our attention is with the repeal of the ACA, then I think the state budget, certainly from a healthcare standpoint, is not sustainable. So that's kind of the backdrop. That's what we're focused on externally. But the cool thing is there's awesome stuff that's happening here locally. I'm confident we have created a strategy that will serve us well regardless of what happens at the federal and state level. So I just want to talk a little bit about that. We're deep into year 2, working with Virginia Mason on implementing, they're helping us develop and implement a lean management system. And so a lean management system is kind of fundamentally, it's focused on increasing patient value and decreasing waste. And I'm really excited about that because we have great people here at Mason General Hospital and family of clinics. They care deeply about the patients. And I think we have opportunities where we could create a better system that would then empower our people to do an even better job. And so in a couple areas, or a few areas that we're actually working on using this lean management system to improve, where I think we do have opportunities for improvement, and those of you that are patients with ours may agree with this, is how we do medication management within our clinics, medication refills, definitely opportunities to improve, how we do scheduling and being able to get patients seen timely within our clinics, and how we do coordination throughout the organization, all have opportunities for improvement. And so using this lean management system, it's helping us create a systematic way of creating and sustaining that improvement. So I'm really stoked about this, and a lot of our folks, the more we get into it and the deeper we get in, the more excited our staff are becoming. So I think that's going to serve us well. It's the right kind of work to be focused on regardless of what's happening at a federal or state level. And then we're also focused on our physician leadership. That's another incredibly important part of our strategy, is making sure that there's strong physician leadership and participation in our strategic direction. I think that will get, quite frankly, we'll have a better strategic direction. We'll have greater engagement with our providers. And that's also against a backdrop where recruitment and retention of providers nationally is a massive issue. It's approaching crisis levels, not having enough providers in communities, and it's particularly acute in rural areas. And so, having this as an impetus, we hope will make it be a differentiating factor as we do recruitment and retention in the future. So we're very focused in that provider leadership space. And I'm very proud of some of the work and accomplishments of our staff, and we've received quite a number of recognitions at the state and federal level. And so the state, the Washington State Hospital Association, we received the Community Health Leadership Award for some of the partnership that we've had with the school district in terms of the Health Science Academy, the community pool, and then what we've done with supporting the Hope Garden. So very proud of that work. And then we also received the Washington State Hospital Association Safe Care Gold Level Award, and we're one of only 2 hospitals, and that's against Virginia Mason and Evergreen and St. Peter's, all of them. There's only 2 hospitals that received a perfect score. We were one, and it's looking at process metrics. So a lot of good work. And then recently we received a very prestigious federal award. Equalis is the name of the organization, and it was for tremendous work that's being done in Olympic physicians around colon cancer screening. And so just really good work that's being done by the staff and being recognized on a state and federal level. So very proud. I'll just close by saying, regardless of what's happening, again, regardless, our future looks very bright. I'm very optimistic about the direction of this organization, and just looking forward to the future regardless of all the uncertainty that we're facing. So thank you.
So I know you have to get off. Do you have time for a couple of questions before you go?
I do, as long as they're easy.
Okay. Does anyone have any questions for Eric before he has to leave?
Please.
You were talking about the $2.5 million shortfall, assuming the ACA goes away. Doesn't that presume that whatever replaces it will not replace some or all of the $2.5 million?
Right, and so, and that's why I said full repeal, because we just don't know, and so we can only do the math under a full repeal, and then, hey, it could be total rainbows and puppy dog kisses and no worries. And that's why, we're not trying to make a strategy based on hobgoblins and shadows, and we're really focused on a horizon that will serve us well regardless. Yeah.
Planning for the worst, hoping for the best.
Anyone else? Okay, well, thank you, Eric. We'll let you get on your way.